my name is Crystal Hernandez, and for this presentation, the topic that I picked was urinary incontinence. Just for the rundown of what it is, urinary incontinence is a common condition where an individual will lose control over their bladder. For example, when an individual sneezes or coughs, they have a sudden urge to urinate, and since it is so unexpected and sudden, the individual is not able to make it to the restroom on time, which will lead to occasional leak of urine, which is also known as incontinence. So we have three different types of incontinence. We have the urge incontinence, we have the stress incontinence, and we have the overflow incontinence. So what is the urge incontinence? So the urge incontinence is a sudden urge to urinate due to an overactive bladder. This will lead to an involuntary urination. This is due to an uninhibited detrusor muscle, which will cause it to contract randomly. Because of this contracting randomly and having no control over it whatsoever, it will lead to frequent urination. And a lot of people that actually experience incontinence, they tend to experience this more throughout the night. But how can we treat this? We can treat it by relaxation techniques and some medications. Some medications can help decrease the detrusor muscle contractions, which will lead to less frequent urinations. Next one is going to be the stress incontinence. So it is when there is an increased abdominal pressure. Some examples of that would be laughing, sneezing, and coughing. That will put some pressure against the bladder, which will cause for some small leaks of urine to come out of our bladders. Another example is pregnancy. Due to a ton of pressure on the bladder, it will cause stress incontinence, which will lead to small amounts of leakage of urine. And then how can we treat this? By straightening our bodies, and then some way that we can straighten it is by Kegel exercises. And then lastly is the overflow incontinence. So this happens when there is a problem with emptying the bladder. This can be due to a blockage in the urine flow. So for examples for men can be a prostate, which will cause pressure against the urethra, and that will cause some retaining issues in patients and in individuals. And then another example will be ineffective detrusor muscle. And that will result in the bladder filling up with urine again. And that will cause leakage in the sphincter. I apologize if I'm pronouncing that incorrectly. But it will cause some leakages here. And then that will result in a weak stream, and then also known as hesitancy. And then that is when there is, it takes a while for an individual to urinate due to a blockage in the flow. And then how can we treat this? So in my case, I do work in the hospital, so I do have a lot of patients that tend to retain their urine. So usually when we start to see that patients are retaining their urine, we start to do a bladder scan. It's kind of like a small ultrasound where we can check the bladder, and it will give us an estimate of how much urine the patient is holding in their bladder. Usually in my case, when it's around 350 milliliters to 400, we page the doctor, we let them know, hey, this patient is retaining. Once it hits to a certain point, what would you like us to do? And for most of my cases, straight cath is our first way that we go. So it is a catheter that we insert, we drain all the urine, and we pull it right back out. So it's not something that the patient keeps with them or has in for a period amount of time. It's just something very quick. So after we do straight cath them, and if the patient is still retaining the urine and not able to urinate, that's when we go and insert a catheter, which is also known as a Foley. And that, with the catheter, patients can have them for hours to days, 2 weeks, 2 months. I've had patients that have had it for years, and that's their only solution for urination. And then some medications that can help is alpha blockers. And then lastly, what are some conditions that can cause urinary incontinence? So some are diabetes, bladder cancer, and Parkinson's. And then some procedures that can lead to it is prostatectomy and hysterectomy, And then those conditions and procedures can damage the nerves and the micturition reflex, and that will end up leading to urinary incontinence. Thank you.